You're busy, we get it. You want the crucial stuff, the key takeaways, without needing a microscope yourself.
Uh-huh.
So today, we're zeroing in on something that can cause, well, real trouble for our dogs and cats. Giardiasis.
That's right. We've sifted through the research on Giardia, and at its heart, it's this tiny, single-celled parasite.
A parasite?
Yeah, it sets up shop right in the intestines. Think of it like a microscopic freeloader causing problems from the inside.
A freeloader, okay. And how does this freeloader get in? It's not pleasant, is it?
No, not really. Infected animals poop out these tiny packages called cysts.
Cysts, right.
And if another animal accidentally eats one of those, bam, infection can happen. So hygiene, or maybe the lack of it, plays a big role.
Gotcha. Lack of hygiene.
Exactly. While both dogs and cats can get Giardia, it's definitely, well, more common in dogs, especially young puppies and maybe dogs living close together, like in kennels.
Okay, so kennels are a hot spot.
Yeah. Cats seem less frequently affected, but, it's still something to be aware of.
Right. So our mission today is to really get a handle on Giardiasis, how it spreads, what signs might tick you off.
How vets figure it out.
And importantly, what we can actually do about it. Okay, let's dive into the basics then. What actually happens inside a dog or cat after they swallow these cysts?
Okay, so once those cysts are inside, they travel down to the small intestine.
The small intestine.
Yep. There they kind of hatch and release the active form of the parasite. These are called trophozoates.
Trophozoates, okay.
Now, these trophozoates have this really interesting feature, a sort of suction cup on their belly.
A suction cup. Seriously?
Like a ventral sucking disc. They use it to stick right onto the lining of the small intestine. They can also detach and, scoot around a bit.
Wow. A parasite with its own built-in suction? That's
Oh.
clever and kind of disgusting, actually.
It is pretty effective for them.
And what kind of trouble do these sticky little things cause?
Well, by attaching to that intestinal lining, they can really mess with how the gut normally absorbs nutrients.
Absorption problems.
Exactly, and that can lead to diarrhea. But here's a key point. Many adult dogs and cats, maybe even most, can be infected.
Infected by
And shedding these immediately infectious cysts without showing a single sign of illness themselves, they seem perfectly fine.
So your seemingly healthy pet could actually be a silent spreader. Wow. That definitely makes you think about how easily this could go around.
Absolutely.
Who is most likely to actually get sick from Giardia then?
The highest risk group is definitely the youngsters, puppies and kittens.
Right, the babies.
Their immune systems are still maturing, basically. That makes them more vulnerable to the parasite and, well, more likely to show symptoms.
Okay, that makes sense.
Then you have animals in crowded environments. Think kennels, catteries, shelters.
High-density places.
Yeah, the more animals close together, the greater the chance of encountering those cysts. And lastly, pets with weakened immune systems for any reason are also at higher risk.
Okay, that paints a clear picture. So with potentially so many carriers out there, how exactly does Giardia make the jump from one animal to another?
Well, as we touched on, it's all about swallowing those cysts that are shed in feces.
Right, eating the cysts.
This can happen directly, like, a dog sniffing and licking a contaminated patch of ground. Or another animal's rear end, maybe.
Okay, direct contact.
But probably the most common way it spreads is actually through contaminated water.
Water, like puddles.
Yeah, shared water bowls, puddles, ponds, even just water sitting around in the environment. That's a huge source.
So it's not always direct contact with poop itself.
Not necessarily, no. These cysts are surprisingly tough, especially in the right conditions.
That's how.
Well, cool, moist environments are perfect for them to survive outside of a host for quite a while.
So damp areas are bad news.
Exactly. Areas like damp soil or standing water can become reservoirs of infection.
Okay, so we know the who and the how. What about the what? If your pet does get sick, what are the red flags that might point towards Giardia?
Well, it's really crucial to remember that those young animals we talked about, they're much more likely to show obvious signs.
Okay, the young ones show it more.
Yeah. Older dogs and cats might not show anything at all, or very little.
Yeah.
When symptoms do appear, they can be, well, all over the map.
Oh, so
They might come on suddenly, maybe disappear quickly, or they could pop up only occasionally, or even stick around and become chronic, a long-term thing.
intermittent or chronic. Got it. And if you do see something, what kind of symptoms are we talking about?
The classic sign of Giardiasis is often linked to what we call malabsorption.
Malabsorption, so not absorbing nutrients properly.
Exactly. Think of it this way. These little parasites sticking to the gut lining make it harder for the intestines to do their job, soaking up nutrients from food.
Right.
That's why you often see this really uh, characteristic diarrhea.
What's it like?
It's often soft, sometimes almost liquid, frequently described as kind of frothy or greasy looking.
Greasy. Why greasy?
Well, because the fats and other things aren't being properly absorbed, they just pass through. And many owners also notice a really distinct, unpleasant, almost rancid smell with it.
Ugh, definitely not a pleasant picture. So if you suspect Giardia based on these not so pleasant signs, how do vets actually nail down the diagnosis? Is it just looking at a poop sample?
Examining feces is definitely the cornerstone, yeah. But routine blood work and urine tests, they usually won't tell you much about a straightforward Giardia infection. They'll likely be normal.
So blood tests are out.
Pretty much. The real focus is on finding the parasite itself in the feces, either that active moving form, the trophozoites,
To swim.
or the dormant cyst form, or even specific Giardia proteins, antigens in the feces.
Okay, let's zoom in on these detection methods. You mentioned trophozoites. When are you most likely to find those?
Trophozoites are most likely seen in really fresh stool samples, like really fresh, especially if the animal has active diarrhea.
So time is critical there.
Definitely. They can also be found in samples taken directly from the small intestine, maybe during an endoscopy. Under the microscope, they have a specific size, kind of a teardrop shape, and they have two very noticeable centers, or nuclei. If you look at a very fresh, wet sample, like a direct smear, you might even see them moving. It's described as a falling leaf motility.
Falling leaf. Interesting.
But the standard solutions we use for routine fecal flotation exams, they tend to break down these trophozoites, they shadow them.
So the usual tests might miss them.
They often will, yes.
So catching the trophozoites is a bit tricky then. What about the cysts? I gather those are what vets usually look for more often.
Exactly. Cysts are more resilient, they hold up better in samples, and importantly, they aren't shed constantly. This intermittent shedding is a key challenge.
Intermittent, meaning not in every bowel movement.
Correct. The animal might shed lots one day, none the next. These cysts are oval-shaped, also tiny, about 12 micrometers long, and they contain between 2 and 4 of those nuclei.
And how do you find them reliably?
The best way, the gold standard really, is using a special lab technique called centrifugal flotation, usually with a specific solution, zinc sulfate, at a specific gravity of 1.18.
Centrifugal flotation.
Yes, technical.
It basically involves spinning the sample down and using a solution that helps the lighter cysts float to the top, separating them from the heavier fecal debris so you can see them under the microscope.
Okay. And this intermittent shedding you mentioned, that sounds like it could make diagnosis tricky.
It really can.
So just because one poop sample looks clear, it doesn't mean the animal's in the clear, right?
Absolutely not. That's why vets often want to see a few samples. It's like trying to catch a sneaky burglar. They're not always going to be around when you look.
Good analogy. How many samples are usually needed?
Well, because the cysts aren't shed all the time, examining multiple stool samples, ideally 3 collected maybe 2 or 3 days apart, significantly increases the chance of actually finding them. We're talking over a 70% detection rate with 3 samples.
3 samples over several days. Okay. And it's also worth noting, just as a technical point, that if a lab uses a sugar-based flotation solution, or one with a specific gravity over 1.25, the cysts can sometimes look a bit squished or distorted, like little crescents.
Which could be confusing.
It could be. And one more thing, if the diarrhea is really greasy, that steatorrhea we mentioned, another technique called formalin ethyl acetate sedimentation can sometimes be more helpful.
Wow, this deep dive into fecal analysis is certainly eye-opening. What about those quick test kits? The ones you can sometimes do in the clinic, or maybe even see advertised?
Yes, the antigen tests. There are commercial ELISA-based test kits that can detect specific Giardia proteins or antigens in the feces.
ELISA tests.
Yeah. They can be handy for quick in-house results, and they can sometimes pick up infections in animals that aren't showing any symptoms.
Sounds useful, but are there catches?
Well, it's important to know that their sensitivity, how well they pick up true positives, can vary compared to that gold standard zinc sulfate flotation method.
So not always as accurate.
Potentially, yes. They can sometimes give false positives, saying Giardia is there when it isn't, or false negatives, missing an infection that is there.
So they're not a guaranteed yes or no then. When should these antigen tests ideally be used?
That's a really good question. Think of the zinc sulfate test as maybe the more traditional, reliable detective looking for the actual culprit, the cysts or trophozoites.
Okay.
The antigen test is maybe like a quicker, sometimes less precise fingerprint analysis, good for a strong lead perhaps, but you might want to double check, especially if the result doesn't quite fit the clinical picture.
So use it carefully.
Generally, yeah. It's often recommended to use these antigen tests maybe to confirm a suspicion rather than as the first screening test you reach for in a perfectly healthy animal.
Right, like if the flotation was negative, but you still really suspect Giardia.
Exactly. If a pet has consistent signs that really point to Giardia, and maybe the initial flotation test is negative, perhaps due to that intermittent shedding, then an antigen test might provide more information or catch it.
Okay, that's a useful distinction. And just to cover all the bases, are there other conditions that can kind of mimic Giardiasis? Things vets need to rule out?
Oh, absolutely. When an animal has diarrhea, particularly the kind originating from the small intestine like we often see with Giardia, there are several other potential causes to consider.
Such as?
Well, it could include other types of infections, certain bacteria, viruses, other parasites besides Giardia, but also non-infectious issues, things like problems with the pancreas, maybe inflammatory bowel disease,
A whole range of things.
a whole range. And in cats specifically, it's important sometimes to rule out another protozoan parasite called Trichomonas blackburni.
Trichomonas. How is that different?
Well, Trichomonas typically causes diarrhea originating from the large intestine, so you might see signs like mucus or fresh blood in the stool, which is different from the typical small bowel malabsorptive diarrhea we usually associate with Giardia.
Large bowel versus small bowel signs. Good distinction.
Yeah, it helps differentiate sometimes.
Right, so it's not always a slam dunk diagnosis just based on the symptoms alone. Once Giardia is confirmed, though, what's the game plan? How do you treat it?
In most cases, treatment is done on an outpatient basis, meaning at home.
Okay.
However, if the animal is very weak or maybe significantly dehydrated from severe diarrhea, they might need supportive care first, like intravenous fluids at the vet clinic to get stabilized.
Makes sense. Get them stable first.
Exactly. But the key to successful treatment is really a two-pronged attack, maybe even three.
No.
Medication, obviously, to get rid of the parasite inside the animal. But just as crucial is combining that with really thorough cleaning and disinfection of the environment
Cleaning everything.
and bathing the pet itself. This helps remove any lingering cysts from their fur. The goal is to break that cycle of reinfection from the environment or from self-grooming.
That makes total sense. You don't want them just getting reinfected immediately from their surroundings or their own coat. Now, I've heard there are vaccines for Giardia, sometimes mentioned. Are those a common part of the treatment or prevention plan?
Yeah, there are vaccines available, but unfortunately studies have shown they generally have pretty poor efficacy.
They don't work well.
Not reliably, no. They don't seem to be very effective in actually preventing infection or preventing clinical signs, so they aren't routinely recommended or used much anymore. The focus is really on the medication and that strict hygiene we talked about.
Okay, hygiene and meds it is. Let's talk about the medications then. What are the usual drugs vets turn to for treating Giardia in dogs and cats?
The most commonly used medications are probably Fenbendazole,
Fenbendazole.
Metronidazole, and a related drug, Metronidazole benzoate, mainly for cats.
Okay, how are they used?
For both dogs and cats, Fenbendazole is often a first choice. It's usually given by mouth once a day for several days, typically 3 to 5 days, sometimes longer.
And does it always work first time?
Not always. Sometimes a second course of treatment might be needed if the infection isn't cleared or if reinfection occurs.
Okay. What about metronidazole?
For dogs, metronidazole is another common choice. It's usually given twice daily for about 5 to 7 days. In cats, a form called metronidazole benzoate is often preferred.
Why a benzoate form for cats?
It's generally considered more palatable for them than regular metronidazole. It's also usually given twice daily for a similar duration, maybe 5 to 10 days.
So a few different tools in the toolbox depending on the species and the situation.
That's right.
Are there any potential downsides or things owners should be aware of with these medications? Like side effects?
Yes, there are things to consider. First, it's important for people to know that the way we use these drugs for Giardia is often technically considered off-label or extra-label, meaning they aren't specifically licensed or approved by regulatory agencies for this exact use in dogs and cats, even though they're widely accepted and used based on scientific evidence and clinical experience.
Okay. Good to know.
Yeah.
What about specific drug issues? Metronidazole.
Well, metronidazole, for instance, studies suggest it's only effective in maybe about 67%, so two-thirds of dogs.
Not 100%. Yeah.
No. And it also has a really bitter taste, which can make it quite difficult to give to some animals, especially cats, hence the benzoate form. It can also cause side effects like loss of appetite, sometimes vomiting, and in some cases, particularly at higher doses or with prolonged use, potential nervous system signs.
Nervous system signs, like what?
Things like wobbliness, disorientation, maybe even seizures in rare cases, usually reversible when the drug is stopped, but definitely something vets monitor for.
Okay. Any other drug concerns? You mentioned another one earlier, albendazole.
Ah, yes, albendazole. It is effective against Giardia, however, it's generally not recommended.
Why not?
Because it has a known potential to cause birth defects, it's teratogenic, and it's also been associated with other potentially serious side effects like bone marrow suppression, which can lead to low blood cell counts, also anorexia, vomiting, depression. So the risks often outweigh the benefits compared to fenbendazole or metronidazole.
Right. Definitely sounds like one to avoid if possible. Those potential side effects really underscore the importance of, following the vet's instructions really carefully.
Absolutely. Dosage, duration, monitoring, it's all important.
What happens after the treatment course is finished? How do you know if it actually worked? Is the pet clear?
Follow-up fecal exams are really important.
Testing again.
Yes, testing again, to make sure the treatment has been successful in clearing the infection, and also to check for any sign of reinfection, which is always possible.
When should that follow-up test be done?
Because those cysts can be shed sporadically, as we discussed, it's usually recommended to have another fecal test done maybe, say, 1 to 2 weeks after the medication is completely finished. Some protocols might vary slightly.
Okay. And what if it's still positive? Or if symptoms come back?
Then a second course of treatment, perhaps with a different drug, might be needed, along with reinforcing those environmental cleaning and hygiene measures. It's also worth noting that sometimes, even after treatment seems successful, a chronic Giardia infection can persist in some animals and potentially lead to ongoing health issues or debilitation over time.
So it can sometimes become a stubborn, long-term problem.
It can in some individuals, yes.
Okay. So to kind of bring it all together then, Giardia is a pretty widespread intestinal parasite, especially in our furry friends when they're young or if they live in group settings like kennels or shelters.
Very common, yes.
It spreads through fecal contamination, ingesting those hardy cysts from poop, water, or the environment.
That's the main route.
Diagnosing it involves careful lab work on stool samples, often needing multiple samples because of that intermittent shedding.
The testing is key.
And treatment requires medication, like fenbendazole or metronidazole, but it's just as important, maybe even more so, to be really meticulous about cleaning up the environment and bathing the pet to prevent that constant re-exposure.
Exactly. You absolutely need that combination approach meds plus hygiene. It's a parasite that needs a comprehensive strategy to manage effectively.
This has been a truly illuminating deep dive into the tiny but troublesome world of Giardia. It's definitely more involved than just a simple case of the runs, isn't it?
It really is.
It makes you think, considering how common Giardia can be, and the fact that so many animals can be silent carriers, shedding cysts without looking sick, what are the wider implications? Especially if you have multiple pets or you frequent public dog parks or other shared spaces.
That's a really important point.
And looking forward, what other research or maybe preventative steps might be worth exploring to get better control over this really persistent little parasite? Some food for thought for you.